Hi, this is your injury, spasm, and pain poster. If you'll notice on the upper right-hand side, where it has the picture of the joint of your shoulder bone, you may notice below it a little box. Inside that box is talking about pain. Whenever you're injured, you actually break open what's known as mast cells. When these mast cells are broken open, they release inflammatory factors known as eicosanoids. These eicosanoids can cause pain and inflammation. Numerous ways to be able to deal with pain can range from prescription drugs, over-the-counter pain relievers, and natural approaches. Both prescription and over-the-counter pain relievers do work effectively, but do have side effects to the gastrointestinal tract and cardiovascular systems. Many studies have actually shown that certain things such as Vioxx, which was recently taken off the marketplace, could lead to a greater risk of such things as heart attack. So when looking at such things as pain relievers, natural approaches do have their benefits. Natural approaches will allow you to be able to lower the pain without any of the possible side effects to the gastrointestinal tract, stomach upset in that case, and cardiovascular system in increasing the risk to cardiovascular disease or heart attack. Utilizing a new substance by the name of thea or tetrahydroisoalpha acids can be very effective and has been shown in studies to work as well as many of the prescription drugs for pain. The next area down shows muscle strands. If you'll notice, the upper strand bundle is a healthy muscle strand where it will contract and it will relax effectively. But where you have yourself a constant state of contraction is a muscle spasm. Along with your injury, you may be having muscle spasm. So to be able to help with individuals with muscle spasm, you may want to be able to include such things as calcium, magnesium, passiflora, and other specific nutrients which have been shown to be helpful to relax the muscle. These are available through the muscle support formula. The next area is the lowest area, where it shows the portion of the spine. The first thing to take a look at is the actual top disc. The top disc is a healthy disc. In a healthy disc, there are little cells inside that disc which utilize nutrients from the surrounding area to be able to rebuild any damage which may be caused by general daily wear and tear. But when you do have an injury, the need for nutrients is much higher. So the need for such things as amino acids, vitamin C, alpha-ketoglutarate, iron, and other nutrients for the tensile strength of those specific joints is essential. You may want to be taking something called our amino acid and vitamin C formula. If you have an actual damage to the joint or the collagenous area of the joint, you may be looking at glucosamine sulfate and also chondroitin. Remember, within the disc, it is what's known as avascular, so therefore there is no blood flow to the disc, so it's very hard to get nutrients into the disc when you've injured it. But there is something called imbibition. That is the actual disc's ability to imbibe or to drink in nutrients from the surrounding tissues. When you have an injury, many of those nutrients are used up, and the disc finds it hard to be able to properly recover from an injury. That is why we would recommend also the utilization of such things as a glucosamine and chondroitin formula to fill those surrounding tissues with specific nutrients so the disc can imbibe or soak them in and help to recover from injury, as well as the vitamin C and amino acid formula. All these specific nutrients are part of your therapy and are an important part of you being able to not only heal, but in addition to that, allowing you to be able to recover from your injury faster and more effectively. At any part of the course that you might find swelling, possibly during the first 3 to 5 days after the injury, we may also be recommending what's known as proteolytic enzymes. They break down the proteins within the area of the injury to allow swelling to go down and to increase the actual speed in which you're able to recover. Well, that's your injury, spasm, and pain poster, and I hope you found it interesting. Your practitioner will give you a copy of it to be able to read, and have a great day.